Hi y'all, it's Mia, and I am going to be teaching you about sickle cell anemia. Sickle cell anemia is basically a disease which is the flattening of your red blood cells and they become sickled. A normal red blood cell looks like round and circular and is very smooth and has like a smooth divot in the middle, which allows them to flow easily throughout blood vessels. Whereas when you have sickle cell anemia and your cells begin to sickle and create like a crescent shape, they actually have a way harder time trying to get through your blood vessels. And you can see that in this diagram. So this is a blood vessel and it has blood flowing through it. When you have sickle cell anemia, not all of your cells are sickled. So it shows some normal and some sickled, but then it also shows a clotting area where they all begin to cluster together and form a blockage, which causes a lot of different complications, and it can cause even more complications in the future if you go so long without being treated. So it's a disease that occurs on the 11th chromosome, and it's a recessive trait. So basically, in order to have it, you have to have two recessive alleles, which one has to come from one parent and the other has to come from the other parent. So some of the Punnett squares to show all of the combinations of genotypes that can create different offspring. There's 6 of them. There's 6 different combinations. The first two are both homozygous, and it's if both parents are homozygous, but one of them is if both parents are homozygous dominant, and if the other is if they're both homozygous recessive. And if they're both homozygous dominant, then all of their offspring are also going to be homozygous dominant, or in other words, they're going to be totally unaffected. Whereas if you're homozygous recessive, both parents, then all of the offspring will also be homozygous recessive, and that means all of them will be affected because they have both recessive alleles. The other 4 options include, one of them is where both parents are heterozygous, which means that there's a 25% chance that the offspring will be normal. There's a 25% chance that they will be affected, and there's a 50% chance that they'll be carriers. And when you're a carrier, even though you have the allele that is affected, it's recessive, and if you have one dominant allele that masks the other, then you're unaffected. And it actually has pros and cons to it, which I can get into later. So another option is if you have one parent that is dominant and it is homozygous, and the other parent is heterozygous. It creates a 50% chance of being both dominant homozygous, and if you have a 50% chance of being dominant homozygous, then you're unaffected. And then the other 50% chance is meaning you're heterozygous, which means you have nothing, but it, like I said earlier, has some pros and cons. The last 2 options are, the first is if one parent is heterozygous and the other is homozygous recessive, then it will create a 25% chance that both alleles will be recessive, which means you are affected, and the other 75% chance is carriers, which is a dominant and a recessive allele. And then for the last option, it is if both are homozygous, but one parent is homozygous dominant and the other is homozygous recessive, which means that all of their offspring will be carriers or heterozygous. Yeah. So basically, this occurs mainly in the African American population. Although like it does occur mainly in them, it still occurs in other ethnicities. It actually occurs in 1 in 12 African Americans, and about 100,000 people are born with it each year, and in America, and then about 500,000 are born with it worldwide in a year. The life expectancy for a male is 42 to 60, and the life expectancy for a female is 48 to 68. Whereas like back then, it actually used to be around like 14 to 17. But as you can see, as times have changed, it now we have a much larger life expectancy, which is very good because nobody likes to die that young. So there's some of the symptoms include blindness, which actually occurs in a lot of cases, the swelling of your hands and feet due to the cutoff of oxygen due to your clogged vessels because of sickle cells. And then another one is a stunt in your growth due to the lower oxygen levels, because there's actually, and also if you have low oxygen levels, it means you have low iron, and we'll get into that a little later. If you have low oxygen levels, because your red blood cells are actually the part of the blood that carry oxygen throughout your body into all of your extremities and organs, and if you have a lower oxygen level or like a cutoff of blood flow due to the sickled cells, it creates organ dysfunction and swelling of your hands and feet, and if they're in the blood vessels of your eye, that's what creates the blindness. Also, with the stunting of your growth, oxygen has iron in it, and if you have an iron deficiency, that's one of like the first like eye grabbers, I guess. It's one of the first things to look for, that doctors might look for in order to see if you have sickle cell anemia. So some of the treatments for all of these symptoms. Oh wait, another symptom is, well, it's more like a disorder that comes along with it sometimes, is acute chest syndrome, which is another complication out of like the thousands of different complications that can come with sickle cell anemia. Some treatments for it include blood transfusion, which is basically where they completely take out all of your blood and fill your body with healthy blood. And then another one is just normal antibiotics or pain relievers for the periodic pain that you'll feel. That's another symptom, is like when you have periodic pain, and when you do have that pain, it's very, very painful. So people a lot of the times will get pain relievers for that. Another option for treatment that works really well is bone marrow transplants, and it's been found to work like very efficiently in people. It doesn't work always, but most of these treatments don't work all the time. Like antibiotics won't do very much, but they are a treatment option for those who have it. And so yeah, that's about it. That's sickle cell anemia, and I am going to do other homework now, so